It was a regular work shift, just like any other. The crew gathered for their morning safety briefing, and everything seemed routine. But for Connor, this day was anything but ordinary. Connor had always been one of the best. He was focused, reliable, and steady under pressure. That was until one day, tragedy struck. And in the weeks following the incident on the job site, something had shifted.
Just one single traumatic event can cause post-traumatic stress disorder. People often suffer with flashbacks, nightmares, consuming thoughts, constant worry, and even panic attacks. This can cause physical issues like dizziness, racing heart, and shortness of breath.
For Connor, every day on the job site felt like reliving the worst moment of his life. The sounds, sights, even the smell of the equipment triggered vivid memories of the accident. Connor was trapped in a cycle of fear and guilt. He couldn't shake the thought that he should have done something differently to prevent the incident. But instead of reaching out, he bottled everything up, worried that admitting his struggles would make him seem weak or unfit for the job. He felt he just had to bury his feelings.
PTSD isn't a sign of weakness. It's a diagnosable mental health condition that can occur after experiencing or witnessing a traumatic event. PTSD is not always due to fatal or extreme scenarios, but can also come from threatened or repetitive experiences. It can also happen to people who are not even directly impacted by an incident, but feel a close connection to the situation or the people involved. Without recognizing the effects of PTSD, or without having the proper supports in place, these symptoms can worsen, affecting every aspect of a person's life.
One day, Connor's supervisor noticed his hesitation during a routine task and decided to have a private conversation. They didn't push. Instead, they listened, and Connor felt safe to open up about the incident and how it's been affecting him. The supervisor connected Connor with resources through the union's assistance program. With their support, Connor started attending therapy sessions and learning coping strategies for his PTSD. Over time, Connor began to rebuild his confidence. Thanks to her experience with Connor, the supervisor realized that others may be struggling with the event. She arranged an informal debrief with the full team. To her surprise, many on the team opened up about their own struggles, now that a safe space, free of judgment, was created.
After experiencing a traumatic event, we must give ourselves the time and space to process. PTSD doesn't follow a set timeline, and everyone experiences trauma differently. However, group post-incident intervention or debriefing can play a vital role in ensuring that those impacted know that support and resources are available.
Connor's journey reminds us that trauma can happen to anyone, but with the right support, recovery is possible. PTSD doesn't have to define a worker's future. Together, we can create a workspace where it's safe to speak up and seek help. Because safety isn't just about physical protection. It's about looking out for each other every step of the way. Remember, safety is everyone's responsibility.